I'm Ailey Joseph, and I'm an epidemiologist at King County Public Health. The work of our team involves tracking and monitoring population health and the social determinants of health. So you just heard about how it's important for an organization to track their emissions data or to see how those numbers change over time. Another kind of data that's important to track is population level data on how climate change impacts people's health. So our team in public health has gathered data on key indicators of climate impacts on health. These include things like heat and cold-related illness, asthma, allergic disease, vector-borne disease, and food and waterborne illness. This data is publicly available, so anyone can view them on our new climate and health dashboard. By tracking this data, we can monitor the impacts of climate events on our community as they become more frequent as well as more severe. For example, if you take cold-related illness, analysis of emergency department visit data shows a 60% increase in ED visits due to extreme cold in just a 2-year period, and a 20% increase in ED visits for asthma in just 1 year. Similarly, in 2021, many of us will remember the unprecedented heat wave that swept the Pacific Northwest, and so during just a 7-day period, we saw 100 deaths across the state. So by tracking this data, we're able to bring visibility to these impacts like we haven't been able to do before. Not just that, we can also see who is most impacted and what disparities exist, because we know that adverse health outcomes are not uniformly distributed. For example, when we look at ED visits for extreme cold, we see that compared to the county overall, American Indian Alaska Native residents and Black residents are between 4 and 5 times as likely to visit the ED due to cold-related illness. The lack of stable housing is another very well-known, huge risk factor for cold-related ED visits. Similarly, the rate among older residents, especially those over 75, are double the overall county rate. Another example is ED visits due to asthma, which is exacerbated due to wildfires and extreme weather. So when we look across geographies in King County, we see some zip codes in the southern part of the county having rates 4.5 times as high for ED visits compared to some other zip codes in the north part of the county. So we really want to get into the weeds of this data and see where and on whom are the disproportionate burdens of climate change falling. So one of the first places we've used this climate data is in the 2024 to 2025 Community Health Needs Assessment, or the CHNA. A CHNA is a very comprehensive document. Every 3 years, we take a deep dive health profile of King County and our diverse communities. The goal of this document is to understand what has changed over time, what has gotten better, what has gotten worse. We also want to know what are the health disparities we're seeing. Are they getting worse? Are they getting better? To create the CHNA, we worked very closely in partnership with 10 King County hospital systems, and they built and shaped this document along with us. This informs their strategic plans as well as some of the investments that they make in their communities. This latest CHNA includes, for the very first time, a chapter on climate. The narrative on climate change also talks about community members' experiences, including how extreme weather events have impacted mental health and food access. So in this document, we have combined quantitative as well as qualitative data to tell this story. I do think this is an important step. Only a handful of CHNAs from health systems across the US include any data indicators or narrative about climate impacts on health. So for a health system that comes face to face with hundreds of thousands of people every day, this makes it kind of a blind spot and a missed opportunity. We can already see that climate change will continue to have broad and far-reaching health implications for our communities. So it's very important to gather this data and make it visible to entities that can actually leverage it for action. In fact, we need more CHNAs across the US to incorporate climate and environmental considerations. It can help our healthcare systems in their strategic planning around climate change. But there are also so many other organizations and sectors that benefit from this document. It can help city, county, and local governments know where to focus efforts and create policy priorities. That includes a lot of program implementation work that happens in our very own health department. Nonprofits and community organizations that don't have the resources to do a health assessment can also use this document in their planning work as well. In addition to the CHNA document having a chapter on climate change, At the health department, we've also included climate change indicators in our routine health surveillance practices as well as systems. This is what we call our community health indicators. I see this as our leaders in public health committing to investments in making the surveillance of climate impacts part of our standard practice, which is great. Of course, health systems can take environmental actions to reduce their own footprint, like auditing their energy consumption, switching to low-emission vehicles, all of which are really important. But they could also benefit from knowledge about the changing patterns in healthcare usage. That will help them be prepared for what we may very well continue to see, which is rising morbidity and mortality due to extreme weather events and other impacts of climate change. So if you're an organization that's looking to prioritize investment in health or climate planning, I encourage you to check out our CHNA as well as our climate dashboard.